Well, good morning, everyone. I'm very pleased to be able to be here today alongside Minister Monte McNaughton and representatives from the Toronto Paramedic Services. During my time as Minister of Health, I've had the opportunity to meet paramedics and tour EMS stations across Ontario and see firsthand how our province's paramedics are providing emergency care to Ontarians wherever and whenever they need it. On behalf of Premier Ford and our government, I want to say a huge thank you to Ontario paramedics for going above and beyond each and every day. Whether you are responding to calls on the front lines in your community or in someone's home, paramedics have been and continue to be a critical part of our healthcare system, saving lives and quickly responding to calls to care for some of Ontario's most vulnerable citizens. And we want you to know that your government has your back. In partnership with paramedics, we have expanded the 911 models of care to provide more appropriate care to people in their homes and in community, including those in need of palliative care or mental health. When we continue to invest in the dedicated offload nursing program, we know this is allowing paramedics to get back into community faster and respond to more calls. We know that working in healthcare, especially throughout the pandemic, has been both challenging and rewarding. We must continue to ensure that our healthcare workers feel supported so that they can continue to care for Ontarians each and every day. Again, I want to thank all Ontario paramedics as we work together to help connect Ontarians to more convenient care closer to home. Thank you again for being here. Stay well, and it is now my honor to hand it over to Minister McNaughton.
Great. Well, thank you very much, Minister Jones. It's an honor to be with you today. And I also want to thank the Chief for hosting us today at EMS Station 1 here in Toronto. To begin, I do want to take a moment, though, to express my sincere condolences to Christopher Stolte's family, who announced his passing on January the 6th. Chris was a lifelong paramedic and worked the majority of his shifts at Station 9 in Grand Bend for Lambton EMS. He was a proud member of SEIU Healthcare, serving as Chief Union Steward and Worker Co-Chair of the Section 21 Subcommittee, always supporting his fellow paramedics. In every community, paramedics are on the front lines each and every day, saving lives. Across Ontario, 12,000 paramedics respond to over 1.6 million emergency calls every year. These heroes work tirelessly to bring us the medical attention we need, and in return, they deserve to get home safe to their families too. When families have to call an ambulance, it's one of the scariest situations they'll ever face. And the paramedics who arrive to help make a huge difference. The calmness they show in an emergency, the respect they show their patients, and the genuine care they show to everyone on the scene has the power to make something traumatic a bit easier. We appreciate Ontario's paramedic community for the work they do, and we care just as much about their safety as they do ours. That is why, to ensure paramedics have access to healthy and safe workplaces, I've established a Paramedic Services Committee to develop resources that address unique health and safety risks these frontline heroes face every day. This committee, comprised of both employer and labour representatives, will have direct input on recommending regulatory changes and actions on emerging issues. They'll also be able to create safety guidelines for their sector that go beyond minimum requirements to keep paramedics safe while they're saving lives themselves. Similar committees already exist for firefighters and police. It's important that paramedics receive the same recognition for the unique risks they face on their job. Until now, they've been covered under a committee that advises on healthcare. But unlike other healthcare professionals who normally see patients in hospitals, homes, or offices, paramedics face many risks as first responders, like transporting patients through traffic, exposure to harmful chemicals at the scene of a workplace accident or drug overdoses, and many more. This new committee, like those for other first responders, recognizes the unique health and safety challenges paramedics face. I look forward to working with the newly established committee to ensure Ontario's paramedics receive the support that they need. And now, to share more about what this means for paramedics and the communities they serve, I'm pleased to welcome Bikram Chawla, Acting Chief of Toronto Paramedic Services, to the podium. Thank you.
Thank you, Minister McNaughton, and welcome everyone. Today's announcement is an important acknowledgement of the unique work that Ontario's paramedics perform every single day, responding to medical emergencies when people need them most. That is why this collaborative committee and its focused recommendations will ensure that the physical, emotional, and psychological well-being of our paramedics remain a top priority. Thank you to Minister Jones and Mr. McNaughton and the Ontario government for prioritizing resources to support these dedicated and skilled individuals who have served on the front line throughout the pandemic with unwavering commitment and continue to serve their communities with care and compassion. Thank you once again, and I will turn it now back over to Minister McNaughton.
Okay, we'll be happy to take any questions if there are any.
Okay, is there any media present that has to identify themselves to ask questions? Do. Okay, so it's one question, one follow-up. Please state your name and your outlet. Thank you.
Hello, Mr. McNaughton. I'm Martin Trainer from the CBC. Quick question, well actually two questions. This is about the Real report, and a criticism directed at the Ontario government was over the use of the Emergency Act, over your, quote, reluctance to act, and greater involvement would have let Ottawa residents know that they had not been abandoned by their provincial government at a time of crisis. So do you accept that criticism?
Well, you know, what we saw during both Ottawa and Windsor is police services and OPP, of course, coming together to help those two communities in need. You know, I often talked while the Ottawa was happening, was in fact we had police officers being redeployed from OPP detachments across Ontario. Under the leadership of Commissioner Creek, there were literally weekly briefings with police chiefs from across Ontario as they found intelligence reports, making sure that all of our police services were aware and informed. And, you know, when Toronto Police Services, when Windsor Police Services, when services and officers from London, York, all over Ontario were coming into those communities and assisting the local, in that case, Ottawa Police Services, it really spoke to the fact that people were stepping up and assisting. As you know, I had many conversations with my federal counterparts. We made sure that any assistance that Ottawa and Windsor ultimately needed or asked for was there from the provincial government. Thank you.
So the report says Ontario should consider establishing a major event management coordinator to help police better deal with the protests across jurisdictions. Will you?
So I think it's also important to remember that Ontario has and continues to have a very robust Provincial Emergency Operations Centre. That information and that knowledge was part of what was happening as we learned or had intelligence gathered from the OPP in particular. We know that there are some lessons learned. I would remind that we also put in some legislation to better protect Ontario and Ontario citizens and communities if we ever experience those kinds of issues again. But once again, I will say, you know, under the leadership of Commissioner Creek, there was an awful lot of coordination that was happening between local police services as well, of course, as the OPP. Thank you.
And that concludes our media availability. Thank you, everyone, for coming.